Hello and welcome back to Your Health Kenya, a space where we get to unpack everything matters health. It is another Friday, another episode where we get to continue with the series that we have been having on reproductive health for women. And today's conversation, we get to unpack and understand everything in regards to endometriosis and adenomyosis. So I want us to go into the treatment options for endometriosis and adenomyosis. What are some of the treatment options that women can explore? And also just to clarify, is there a particular cure for endometriosis, or is it just a set of a spectrum of treatment options?
So I'll answer that question by speaking.
Okay.
All right. So the commonest reason why she will come to see us is the pain. So we're investigating pain and we find she has this. So thankfully nowadays, we have certain hormonal treatments, hormonal drugs. There's a molecule called Dinogest. It's widely available. Its job basically is to strangle, literally, to strangle this tissue of its ability to get vitality to grow. I'm using layman's language. So we are inhibiting its ability to grow.
Okay.
So these are tablets taken daily. So we can stop it. And linked to that would be hormonal treatments if she doesn't want to conceive, to cut her from having her cycles. There are treatments we can use to stop the cycles. So we don't have the cycles of growth of the endometrium, growth of the adenomyosis tissue or endometriotic tissue. So we can cut that cycle and give great relief.
Okay. And just to clarify, are those now, do they fall under the category of contraceptives, or it's just hormonal?
Well, contraceptives can be used to do it.
Okay.
But others are not typically contraceptives, but do the hormonal work.
Okay.
So not all hormones are contraceptives.
Okay.
Licensed.
Yeah, I think it's good to clarify.
Exactly. So when you're taking these, you might want to see your gynecologist to ensure that other things are being used.
Yes.
Okay.
And it's good to confirm from your gyna which kind
important.
of hormonal
So don't go and take it off the counter yourself. Say, I heard him saying, give me that one. No.
Yes.
Let your gynecologist
it has to
guide
be prescribed.
the process. Yes. So there are medical treatments, drugs, which are hormones, that are given that can inhibit the growth of these deposits, but they have to be taken long term. They can be taken 6 months, 8 months, and then we'll see.
Okay.
The other things, if for example we have already damage where things are stuck on each other, then doctors might want to operate and separate, breaking the adhesions, the sticking togethers of all these structures in the body.
Okay.
So that might be important.
Okay.
You might find that there are cysts inside, which the chocolate cysts I talked about, and they're grown. There are doctors who can go in and drain them.
Okay.
Very important.
Okay.
To help out.
All right. So is that like a surgical
Those are surgical treatments now.
treatment options?
So
and is it an open surgery, or is it laparoscopy?
Some are open, but laparoscopically. Typically now, a lot of these can be done laparoscopically.
Okay.
Unless it's indicated there's a problem as to why she shouldn't. Largely, they'll be done laparoscopically.
Okay.
So they can go in, separate, drain cysts, etc., and then put her on these hormonal treatments, which stop the recurrence of these from happening.
Okay.
So the treatment could be as simple as painkillers, the same drugs we use for birth control, to the one I've just talked about, which is specific. And that now has become almost like the gold standard of treatment, the first line of treatment. It's called Dinogest. It's in the market. Doctors know this, gynecologists know this. So it's given to them. If there are other complications, for example, there are patients for whom it's in the lungs and it has to be removed. They can be removed. We also used to go in and remove some of the deposits, the endometriotic tissue deposits that are there can be removed also. These are surgical treatments. If it's in the brain, we can remove it.
Wow.
Okay? But largely, it doesn't have to get there. If a lady is having painful periods, let her come early, because the earlier she comes, then we can institute treatments to ensure that it doesn't progress further to become the most serious forms of it all.
And I know part of the challenge for a lot of women, if I was to speak for quite a number of women, and even just listening to the late Jambi Kokai's story, there's a lot of challenge when it comes to diagnosis of endo. So you find many women, they've gone to a hospital, but then there's been a lot of misdiagnosis. By the time they're figuring out that they're actually suffering from endo, it's far gone.
It's true. we have complicated, and again now it's spoiled her tubes, and there goes her fertility. So the take-home message is painful periods, let's sort them out early.
Okay.
Because a lot of what would just go under the radar as painful periods, take your Panadol, was adenomyosis and endometriosis, with the attendant risks of it progressing and destroying a woman's fertility.
And what level of pain are we talking about? Because for every woman, when we go through our menses, there's a level of period pain, the cramps that we get to experience. So how do you differentiate between what is normal cramps versus what is, a bit too far gone?
That's an interesting question. As a lady, I would normally ask a lady, you tell me.
Well, it's true. Yeah, it's true.
It's true. Actually, the truth of the matter is, if it stops you from doing your daily activities, it's that much.
Okay.
Pain is very subjective. Let's just say, if you feel, this is a bit too painful, something is wrong here, come.
Okay.
That's the best way I can put it.
Okay.
We talk about pain scales.
Yeah.
We know on a scale of 1 to 10. If a woman's pain is 1, 2, 3, if she says it's 4, 5, 6 and above, let her come and see a doctor.
Okay.
Certainly, if she's uncomfortable, it's better to come and be told it's nothing. We can still treat pain than to say, let me just live with this. And then it progresses on into something more sinister.
Okay, that's great. So we've talked about some of the treatment options for endometriosis and as well as adenomyosis.
Yes.
Which some of them are the medication.
So we have
the
medical
hormonal,
treatments and then surgical treatments.
And then surgical treatment.
Right.
Are there any lifestyle changes or supplements that can be used to manage these conditions?
Well, I'll just say this. It's better to keep healthy diet, exercise, weight, good weight.
Okay.
Did you know that exercising, for example, people who have painful periods, it is said that if you exercise, using exercises that involve a lot of blood rushing to the pelvic area, that would be, for example, squats, etc., helps to wash away some of the mediators of pain. Okay. So it's counterintuitive. When your periods, you don't want to do any exercise, but if you're doing exercise, it might reduce the pain slightly. Yeah. So basically, it's just a normal, good, healthy weight, good diet, the usual things. There's nothing different. It's just maintaining a healthy lifestyle. Nothing so specific to that, but maintaining a healthy lifestyle of weight, exercise should help out. But in certain diseases, even with, the most athletic of people still suffer from these things. So diet and exercise are generally good for many other things. We should all be doing that. The point is, when this comes, if it comes, come and see your doctors early. So that we can cut it and nip it in the bud as soon as we can.
Okay. Are there any particular supplements, perhaps, that are also used alongside?
It's called evening oil of primrose, might help.
Okay.
I'm not too sure whether they do because it's so subjective.
Okay.
What I do know that helps is because once we know the basis of the disease, then we attack it based on the basis of the disease.
Okay.
We can cut the hormones that are feeding it and therefore nip it in the bud.
Okay. Right. My next question was going to be around, how do these two conditions impact fertility? And are there any implications to that?
Okay, so aforementioned, especially the endo, when you're having scarring outside the uterus, you're messing up with the tubes. We see the tubes as kinked, coiled, scarred, hiding, all that happens. The internal lining of a tube is a very specialized structure. It has got finger-like projections of hair whose job it is to push the ball. They're called fimbriae. They push the ball, which is the egg, towards the center of the uterus to meet literally the groom, which is the sperm coming. If those particular hairs, that lining is damaged, then we're having problems with fertility. The tubes have a little hole, the space inside. If scarring happens and blocks off, we're going to have fertility problems. So basically, it's this inflammation, this scarring that happens that is going to affect a woman's fertility. And that's the basis of which we say that endometriosis is going to affect a woman's fertility negatively.
All right. And is there a treatment option for that? Or is it just a done and dusted case?
Thank you. We don't need the tubes now. Thank God for them.
Okay.
But sometimes we have to remove them where we can go for assisted reproductive methods. Kenya, we are really blessed. We do have these things here, a dime a dozen. They're all over, mushrooming, quality healthcare professionals who can assist what lay people call test tube babies. In vitro fertilization, there are many techniques. We call them assisted reproduction. We can take egg from the lady, sperm from the man, have them meet under specific conditions in a lab, and have the baby or babies placed back in the woman's womb to grow as normal children with a soul. People say, look at their eyes. They're those ones. No. They're normal.
Okay.
Normal. All we're doing is bypassing the natural place and mechanism by which they meet, and doing it outside in very, very specialized conditions, and then put them back in where they belong into the womb, and they grow.
Okay.
And many of us might be test tube babies.
Yeah.
And we're okay.
Yeah. What about impact on the sexual life? Because I think there's also been
Thank you, my dear. It's pain. Imagine having consistent pain all the time. Yes, and we know ladies are much more more than just the sum of their parts. So anything stressful to a lady is going to kill her libido. So she's dealing with pain all the time. So
does it also mean painful sex, or just...
It could? Yes, dyspareunia is part of it. Yes, because those deposits are painful. Those things, the adhesions where things are matted and holding together, can cause pain. The cysts that form are causing pain. So during the intimate act, when anything close to the uterus or the sides is pushed, it gives off pain. So yes, that again is going to cause significant friction in the home, because the lady might become averse completely to intimacy.
Yeah. Any hope, any treatment option, any way that a woman can, I don't know, like improve or...
Well, we have to take that pain out. So again, it might be what I talked about, Visan. Visan really does help. It's our first port of call to put a woman on this particular treatment. Dinogest, rather. It's the molecule's name is Dinogest. Visan is a brand name. I'm not here to up a brand over the other. But Dinogest is the molecule. We give you that for long, 3 months, 4 months. And a lot of women will say, my goodness, yes, the index of health goes up. She's happier, there's less pain, she's back to working, life becomes rosy again. And many of them are enthused to continue with that particular management. And it's safe to continue with this management for quite a while.
Okay. So would you say that's one of the emerging treatment
It's been there for a while, but it's the first line.
Okay.
It's there.
So at the moment, there's no particular new emerging treatment for endo.
That's what we'll call new.
Okay.
And let's put it this way. Doesn't mean that old doesn't work, even if it was 10 years old. If it's old and effective and has reduced side effects, it has a good safety profile, we'll use it. There are a lot of drugs which are decades old.
Yeah.
And they're still here because they are really, really good.
Yes.
So we use them.
Okay. All right. Great. What a great way to land the conversation. Thank you so much, Dr. Wasuna. That brings us to the end of today's conversation, just unpacking what endometriosis and adenomyosis is. And I really do hope that you have learned something from today's conversation, particularly just making sure that you get to go see your doctor anytime you notice something is off with your body, whether it's pain or, you've just noticed certain changes with your menstrual cycle. Just make sure that you go see your doctor as soon as possible. I think, as Dr. said today, things could get worse, if you don't make that visit sooner enough. So the sooner you make your visit to the doctor, the earlier they'll be able to detect some of these conditions, and the earlier they will begin the treatment. But that's it for today's conversation. Do share this episode with someone so that we can get to grow and learn together. Until next time, we will be going to our next conversation.